it as a practical. There's quite a lot there that Tony will be covering, but I just wanted to talk about our neurovascular assessment. This is something that's really important because we're already so good at measuring like sensory deficit, and we can be reporting on that. So my advice would be, we'll throw in the first MPJ and the ankle range of motion results into that one as well, so that if you're doing these tests annually, you've actually got a measurable record that you can start referring to. The paper grip test is an interesting one. They used it years and years ago in leprosy victims to try and work out how much loss of sensation they had and loss of strength. This is one that Hilton Men's used as well. It's not like really evidence-based, but I'm thinking for a chair-side kind of test, and I've got the papers on this if you'd like it. That's a really easy one to do. Just to they put a piece of card that's about 280 GSM under the toe, the patient's sitting down, and they've got to push down against the paper while you try and pull it away, and you can test the hallux and you can also test the lesser toes. And that's something that can give you a very quick picture of what that pressure strength is underneath the first hallux, which is an indicator for falls risk. So I would also, we've already mentioned about measuring, making sure your patients get their feet measured. I think it's also important the patient knows what their shoe size is. There can be some differences between shoes, but if they know what the shoe size is, there's less risk, as I find with my clients, that they come back with a shoe that's too big. Not often it's too small, it's usually just a bit too big. Right. So, the most important thing I think we should be doing is making sure that we're asking the question, have you had a fall in the past 12 months? This is a really easy one to add to your initial patient assessment, and it doesn't mean you have to address it in that initial consultation. It just means you've got it there, you can talk about it at some point, you can maybe discuss it, see how serious you think it is, but over the next year and those 6 to 8 treatments, you can actually have a bit of a plan of how you address these their footwear or their falls risk, sorry. So, well, I guess I'm saying that because that's what I do. It's to do a proper falls assessment is too much in one go, but you can break it down. I'm sorry I haven't got any templates of how I do it, but I'm sure that Podiatry WA could come up with something. Anyway, create useful and effective records and communicate them to the team. If there is no team, create one. It's really important because it's such a huge multi-factored issue. You can't do it on your own, so you need to involve the GP, you need to involve like a physio or an exercise physiologist. Pharmacists are important. You should be asking them, have they had their eyes tested, their hearing tested recently? I bring up the subject of incontinence or urgency of going to the toilet, or how many times they get up during the night, because that can be a modifiable risk factor. Also, dietitians are important, OTs, footwear specialists. So build a bit of a team and make sure that you communicate with them. They did find that interventions that are specifically and individually tailored to target the risk factors make a much bigger impact than just a general one-size-fits-all. That's kind of common sense, I guess. I did say that I wanted to mention the younger age group. So we've been talking about 65-year-olds and over. In Keith Hill's webinar, he did talk about the 15% of falls that ended up in hospitalisation that occur in the under 65-year-olds. So if we're looking at making a difference to the rate of falls, which we really have to do to make a difference to a problem that's affecting a growing population, an increasing population of aged people, maybe as podiatrists we can be looking at that younger age group. So doing something about those 15% of falls that are happening between the ages of, say, 50 and 65. So consider that when you're doing your assessments. Just have that at the back of your mind, that it's not your 68-year-old, 74-year-old client. It could be me, and it has been me. Okay, so exercise. Exercise is one of the most consistently positive interventions that reduce falls. exercises that emphasise balance training and resistance training are integrative, like Tai Chi, which is balance, strength and movement, and are progressive in their intensity, are most effective. Tony's going to talk more about that, however I did mention the webinar from Melinda Smith, and there's also the Foothold program with Hilton Men's that's available to everybody online. But the key here is progressive. So, right. Guess what, nearly finished. Wait a minute. Getting too enthusiastic. All right, so my challenge to you, or your challenge should you wish to accept it, is ask. Just ask that question, have you had a fall in the past 12 months? And build it up from there. But we've just got to get used to making sure that we ask the question, but now you've got a whole lot more resources and an idea of how you can actually make yourself a proactive professional in this space. Because physios and OTs have been doing this stuff for years and years, and I just think that podiatrists have been doing it informally and, you know, in the background, and it's really important for us to kind of take our position, you know, in the front of that team, or, you know, up in the front with that team anyway. So, that's it from me. So, thanks guys.